So today's Culture Bite is really about wrapping your mind around this idea that our organizations, as complex as they are, you can kind of break it down into the tangibles and the intangibles and thinking about how you can intentionally and deliberately design, change, and improve many aspects of your organization, including your culture or those intangibles.
Welcome to Culture Change RX, the podcast for healthcare professionals that are committed to creating a thriving workplace culture, improving the experiences of employees and patients, and ultimately unlocking their organization's next level of potential. I'm Sue Tetzloff, your host and co-founder of Capstone Leadership Solutions. Join me and my insightful guests each week as we share actionable insights for navigating the crucial people side of the business of healthcare. Subscribe now for a weekly dose of Culture Change RX. Now let's dive into this week's conversation where culture change takes center stage.
Welcome to this episode of Culture Bytes. So these are shorter, punchier episodes that are going to be in our Culture Change RX podcast lineup. And this is an opportunity to have a short focus on this very important topic of culture. So I was getting ready to prepare for an event. It's not coming up until April 17th. It's an annual meeting of critical access hospitals and rural health clinics in North Dakota. And as I'm getting ready for this event and putting some thoughts around it, I was looking through some of our materials on the topic of don't love your culture, then transform it. So that is the name of the topic I'm going to be presenting at this event coming up in April. And so I was looking through some of the materials that we've used to teach on this topic in the past, and I came across a webinar that we had done, and there was a short little clip in it, and I thought, geez, let's just put that out there in the podcast. And I think you'll really enjoy the idea of thinking about your organization from a holistic perspective of both intangible and tangibles, and how culture is some of that intangible stuff, but how it interplays with the tangible things in our organization. And so I think this clip is kind of a helpful, short little moment that we can take in our day, in our week, to really wrap our minds around this real complex thing and put it kind of in a context where maybe we can do something with it, right? So sometimes it feels so big and complex and maybe impossible to get at, right? So how do we intentionally design the intangible? But if we don't, then it's by default, right? And we want to deliberately design. We want to change our culture in intentional ways. We want to give thoughtful consideration to that. We wouldn't leave the design of very tangible things in our organizations, like our buildings or our technology, like certain processes. We wouldn't leave these things to chance, nor should we leave our culture to chance.
If you look at your healthcare organization, whether you're a medical office, whether you're a huge tertiary multi-campus facility, etc., is that when you look at any organization or any business, there's many components to it, some of which are tangible, like your buildings, right? You can see them, you can feel them, you can touch them. You know if it looked this way one day and it looks different another day, you know what it took to make it from one to the other. But when it comes to the intangible, it's not that easy, right? To just see it. It's one of those things that is felt. It's intangible. We call that your invisible infrastructure, where the tangible is your visible infrastructure. And really, your organization is made up of both. And then in between there is your technology, your supplies, your equipment, your systems, your processes, your standards. All of those things are part of the makeup of your organization. So some are concrete and some are culture, some are tangible, some are intangible. But really, what's going on in all of this is that people are interacting or interfacing with all of this, whether it's tangible or intangible. People, whether that's your employees, your visitors, your volunteers, your patients, everyone is interacting with all of this, both the tangible and the intangible. So they're interacting and they're impacted by all of it. So for instance, one of the hospitals that we worked with, they wanted to build a new building, right? A brand new hospital, brand new campus. And one of the things they realized in that building project was they also had to consider the intangible. And so while they were planning the actual physical design of the space and the functional adjacencies and all of the new equipment and supplies and stuff that they were going to put in that new space, they didn't want to take old beds, old equipment in there. They wanted all shiny and new, but they also wanted all shiny and new behaviors, beliefs, service culture, workforce culture, and all of that. They didn't want to take their old culture into the new building either. I thought that was so insightful that they looked at it more holistically than just the concrete. I love that. They didn't want to take their old culture into the new building. And in working with the clinic that we were working with, they actually were totally renovating their clinic into beautiful new space, updating that tangible asset. And one of the things that we had to bring to their attention, because they weren't really thinking about it, was that when they get into that new space and it's shiny and new and beautiful, it's going to be the backdrop to what could be not so great behaviors or beliefs. And now there's going to be this contrast of something really beautiful, their new building, with something not so beautiful, the behaviors and the performance and the service culture and that of the clinic. And so thinking of this more holistically, like we would our health, is what we're optimally shooting for. And really also thinking about this is maybe shifting our mindset, that focusing on the intangible, that it is actually what drives the tangible versus the other way around. So really emphasizing what's intangible. So an example might be something with pay and benefit structures. So those are kind of tangible things, right? How much we pay somebody is kind of a tangible thing. It's a system or a process or a plan that we have that you could actually look at and see that these are the pay rates, these are the benefits. That's something that's kind of tangible. But what drives decisions about that tangible thing is our organization's values and beliefs. So if we really have a value and a belief that we hold dearly related to internal and external pay equity, then that's going to drive our decisions about tangible things like our pay and benefit programs. Same thing could be is if we really value the well-being of our workforce and we truly hold that intangible belief strongly in our organization, then we will act on it and make decisions on it when we're setting up programs and tangible things like space for employee fitness or well-being and the like. So you see what I mean here is it should be that it is our intangibles, our values, our beliefs, the things we hold strong and dear as part of our organization is that drives our decision-making, our resource allocations, and decisions about things that are more tangible, not the other way around. But there's always this interplay between these two parts. If you want to put them in two big buckets, our buildings and our behaviors and beliefs, or tangible and intangible.
Thanks for tuning in to Culture Change RX. If you found value in today's episode and you are a believer in fostering change in healthcare, join us in making a difference. Follow, rate, and review our podcast on your favorite platform. Share it with colleagues and your network. Together, we can make a lasting impact. Until next week, keep inspiring positive change.